Welcome back to Aging in Place Strategies and Answers. This is Linda Prio, and I have a lot to tell you today. And because we are at that time of year when we start thinking about enrollment and insurance enrollment, I knew that it was going to be very important to bring my guest back on my podcast so that you could be the first to hear about some of these changes that are going to happen for Medicare beneficiaries. But before I bring my guest onto the show, Mary Jane Harris, who is the owner of Independent Medicare Advisors, I want to share an announcement that I had heard in my marketplace. And the announcement came from the Mercy Health System, and they said that as of 1/1, 2025, they will no longer be accepting Anthem, Blue Cross, Blue Shield as a payer source in their healthcare system. And that's a pretty big announcement. And if you want to research that announcement, feel free, because it didn't come lightly for this healthcare system to announce that. But there were specific reasons that they felt required this kind of action. I will tell you that whether it's Blue Cross Blue Shield, whether it's Anthem, or whatever it's called in your area, I want you to be aware of this announcement because it not only affects the Medicare Advantage plans, it also affects private insurance, and it also is a factor in the open marketplace insurance product that they offer. And I'm just going to share a high-level overview for my listeners about some of the reasons why Mercy had been in negotiations in the St. Louis market, Mercy Health Systems in the St. Louis market, and those negotiations were brought to the table. There were lots of discussions and nothing changed. So this is why the announcement came. Now, I told Mary Jane, my guest today, that I'm on Florida time. So when I came to Florida and I started talking to my daughter who lives in Florida, and we started talking about Mercy Health Systems, she used to work at Mercy. And she said, Mom, it's not just Missouri. She said, our big healthcare system in the town in which I live has made this same announcement. So I want to get all nervous and upset, but I know that the announcement was made at a certain time so that you would be able to make appropriate decisions. So that's why we're having this podcast today. Some of the reasons why Anthem is being dropped is the healthcare systems say that there's rising costs for care and that they are being asked to bear the brunt of higher costs. Also, administrative burdens that have been placed on patients and caregivers that the health system says that Anthem has put upon these folks. There's also some contract language within the plan that would keep specialty medications unnecessarily expensive. And there were negotiations, as I've mentioned, but the health systems feel that there are increased costs for consumers and employers and providers, but no negotiation from Anthem. So to me, that means money, money, money. Okay. And of course, if you're not getting the kind of level of health care that a medical professional feels that you need, I say thank you to the healthcare systems that are stepping up and bringing this to our attention. But this is not all we're going to talk about today. So I'm going to move along and tell you that I'm thrilled that these announcements came during this time, because as you know, open enrollment or any time you're going to make changes to your insurance plan, it's usually in the fall before a new year. So whether you have private insurance, you have an Advantage plan, or you're in traditional Medicare, it's time to get your cards out, your insurance cards, see who you're insured by, see what kind of plan you have, remind yourself of what your deductibles look like and what providers you can go to, so that when you start thinking this through, you'll have a better grasp of the product that you actually do have. Now, Mary Jane came on my podcast very early in season one. She was episode 6. So thank you, Mary Jane, for believing in me and coming on my podcast. But Mary Jane created a business model that allows her to be an advisor. She is not a broker for a particular insurance plan. She is looking at it as a third party point of view, which means that you're going to get an unbiased perspective. And there's a lot of things that come into and are part of the factors that you look at as you're working with a client. So I'm going to have Mary Jane say hello. Tell us how we can get in touch with her, and also just some of the things she looks at when she's trying to help somebody figure out their insurance and how to save costs. So thanks again, Mary Jane, for being with me. Say hello to my listeners.
Hello to Linda's listeners, and I hope there's a lot of you out there because I know Linda has great information. And Linda, thank you for having me again. It is a pleasure always to speak with you.
Always.
And to your listeners. So it's a busy time. It's a real busy time. I have a business called Independent Medicare Advisors, and what I do is I try to help people who want help to make their Medicare decisions. I help a lot of people who are just turning 65 or perhaps are still working, and then they retire and they're like, okay, I'm ready for Medicare now. What in the world do I do?
Yes.
So, there's a whole lot of different scenarios, which is why I offer a free, 15, 20-minute phone call just to see if people number one, need my service. Because because I'm not an insurance broker, I do charge for my services much as you would any other consultant.
Absolutely.
So, and that's not for everybody. And sometimes I can answer questions really quick. Ones that are easy to answer are this insurance agent called me out of the blue last week and wants me to change my plan. Well, that's an easy, don't do it. Don't do it until you have, what do they have to offer? Why are they asking you to change? And really looking at the reasons behind that, because if you don't change your plan during an enrollment period, you have to qualify for a special enrollment period. And unless you've moved to a different area or you've moved into a nursing home, or say you've moved from, Missouri to Florida and you have a Medicare Advantage plan, there really is no reason to change, and you can't change. So even some of my clients that are, younger, just turning 65, and we've worked through and what plan they should have, and they call me and they'll say, oh, I just had one recently, actually. He got talked into switching his plan. Now the fella has a little bit of early memory loss, but these folks can have a way of speaking that makes them think like this is the right thing to do.
Correct.
So it made for a lot of phone calls on the part of his wife that he had to, get back into his old plan. So and not all insurance agents are like that. These are very often call centers. If you have a great agent, stick with them because they're going to hold your hand through through all of your Medicare issues. And if you don't have issues, helping you to decide at the end of each year, what should I do, during this open enrollment period. Mm-hmm. So for this year, how you can reach me is independentmedicareadvisors.com. And my phone number is 636-485-2615. And I'm happy to help. Again, I offer a free 15, 20-minute phone call to see if you need my help. And then we can go from there if you do.
So I want to just stop right there before she goes into the next sentence, just because Mary Jane and I have some history between us. And I worked for a vendor that did flu shots in your building. Mm-hmm. And Mary Jane's residents would come with their wallets open and
Hmm.
say, "This is what I have. Tell me if I can get my flu shot for free."
Hmm.
And I was as green as they came. And I'd look at them and I think, "And you want me to help you?" And then I realized it was pretty simple. It's right there.
Hmm.
"Well, ma'am, it says that you have this insurance."
Hmm.
And so this is the world in which Mary Jane and I
Hmm.
have lived for a very long time.
Hmm.
And so we are not saying that people can't figure this out, but it has been our experience over the years to observe that there's a lot of advertisements on
Hmm.
TV. There's a lot of people calling seniors.
Hmm.
And there's a lot of mail that comes to your home that is not
Hmm.
marked appropriately, and you think it's coming straight from Social Security or Medicare. And so the value of a professional
Hmm.
consultation and working with somebody
Hmm.
really helps because there's a lot to know.
There is a lot to know. And, and the thing is gone are the days, like for example, my parents, um, they were on regular Medicare with a supplement. There wasn't anything else. It was straightforward.
Yes,
Medicare paid, and then they sent the remainder of the bill to your supplement, and that you were done. And you got the care you needed from whoever you wanted. And then Medicare Advantage came along, and that is, it's privatized. So if you have a Medicare Advantage plan, you're typically with United Healthcare and Aetna, Humana, although Humana's limiting some of their plans as well. Um, and it works for a lot of people, for people who
yes,
cannot afford to pay, 180 to $210 a month for a Medicare supplement plan. It helps them get the care they need.
yes,
So it's nice because it's a blend of many things, and people have choice. But sometimes our choices get too big, like in the cereal aisle, and the cereal aisle is massive. Well, do I want those? Are these better for me? You're looking at the back of the box and you're trying to figure it out. Too many choices sometimes confuses. And then you have all this outside chatter, like you said, Linda, from television, from radio, from mail, people calling you. So, I'm just here to help if people
yes,
want it. Right.
yes, yes, because you do not want your choices limited by the insurance that you carry. End of
Hmm.
statement. Take it for what it is, because that
Right.
can happen. And this is what's going
Yes.
to happen in the
Yes.
marketplace if you happen
Hmm.
to have Anthem. Now, there's other hospitals you can go to, so not a
Hmm.
worry. But if you were connected with a particular health system, now you're going
Hmm.
to have to remember, oh, yes, they don't carry my insurance. Okay.
Correct. Yes.
So, so is it just insurance? Are you looking at their drug plans? Like, what are something, is that kind of how you're able to kind of save people money when you're visiting with them?
Yes, what I do if somebody is, first getting on Medicare, um, what I do is I talk with them, and what are your needs? Do you have a lot of healthcare needs? Do you have a particular doctor that you've had a good relationship with and you want to continue that? What medications are you on? Is it more important to you to have a fixed cost every month and know that you're taken care of, or do you want to save? You want to pinch? And so I get real detailed about what their desires are for their health insurance. The thing about networks is that people are used to those now with their
Yes.
employer insurance.
Yes.
So it's become more of a norm for people to expect a network.
Yes.
So and particularly in metropolitan areas such as St. Louis, where you have a lot of good healthcare providers, you can find good healthcare with a Medicare Advantage plan. But the rub comes then if your plan decides, oh, I'm no longer going to, we're not going to be in collaboration with Mercy anymore, and all your doctors are at Mercy,
Hmm.
um, and you want to stay there. You like to use the Mercy system. Well, now you can't. So, it limits your freedom,
Yes.
limits
Yes.
your freedom of provider. Um,
So I was sitting in a meeting one morning and started hearing some changes that were coming
Mhm,
into the Medicare
mhm,
enrollment period for
mhm.
2025, starting to get a little nervous. And I said, "Oh, Mary Jane, will you help us figure this out? What are some of the changes that you're seeing that we need to be aware of going into 2025?"
Well, I think that the biggest changes are in the Part D plans. And there's some good news. There's some really good news.
Great, great. I like good news.
Yeah, there's good news. So the changes for 2025 in Medicare Part D are that number one, your out of pocket is going to be capped at $2,000, period.
Yay.
Okay. Yeah. They've done away with, I don't know if you've heard of it, but the donut hole is gone. The,
Yay, buy
well, it will
donuts.
be gone. So there are different phases now that don't include the donut hole, and I'll go into detail on those. And then the other thing is if the deductible is going to be $590. So in your initial phase, you spend $590
On
before or
drugs.
deductible phase before you go to the initial phase. But some plans, if you are on tier one or tier two drugs, they have a zero deductible. Okay. So it just depends. If you're on brand name drugs, this is really, really helpful. If
Great.
you're on generic drugs, prescription drugs, I don't mean drugs, but prescription drugs,
Yes.
then you may not see a whole lot of difference, but you can know and have that assurance that the most I'm going to pay for my medications is $2,000 a calendar year. And there's some comfort in that, I think, for folks. If there would be for me, or going to be when I get there. So,
Right. I remember a
uh,
lady coming down to pick up, and I mentioned this probably in our very first podcast, that she came down to the desk at the front of her retirement community building, and she
mhm,
says, "I'm picking up my husband's medicine. Can you believe this small package is $1,000?" And
uh-huh,
I almost hyperventilated for her
mhm,
because I thought to myself, there's no way to
mhm,
afford that big picture
no,
and long term.
mhm,
So that is really good
mhm,
news. And, Mary Jane and I were happy to see people going on Medicare Advantage plans
mhm,
because it
mhm,
helped the cost be
mhm,
contained in a way that was more affordable. So
right,
this is a big deal for the drug plans to finally be
mhm,
reeled in a little bit so that we can
mhm. It's more affordable. And,
affordable.
if you do, so most Medicare Advantage plans roll in the prescription drug plan into the Medicare Advantage plan.
Yes.
If you have original Medicare with a Medigap supplement, you have a standalone prescription drug plan.
Yes.
So everyone will get it's called an ANA, and if you're a Medicare beneficiary, you should have received it already. It's supposed to be out by September 30th, and we're almost there. So this ANOC is especially important this year, just like what Linda was talking about with Anthem, and then also because of these changes in drug plans. Okay. Um, you know, Insurance companies are a business. And if under this plan, they're going to be taking on more of the medication costs for their beneficiaries. Businesses like to make that money up somewhere.
Yes.
Okay. And so you may see when you get your annual notice of change, and you really, really, really need to look at it. Number one, look at the formulary. Are your medications still covered? Okay. Number two, if they are, what are the copays? What are the co-insurances? And is your pharmacy still in network? Okay. And really, this is really important every year, but even more so this year. Every year when you get that annual notice of change, and you only get one, okay, and it's going to
Yes.
tell you exactly what's changing with your health plan, and
Mhm.
you really need to pay attention to it, because then right after that is your open enrollment period. So, you know, October 15th through December 7th. So you have that period of time to change if you want to change. Okay.
Yes.
Uh,
So, did you hear what Mary Jane said? And I'll just rephrase because you've got two choices. You can be reactive and say, my
mhm,
hair's on fire. I didn't know you sent me that. Oh my gosh, what are you talking
mhm,
about? I didn't know Mercy or whatever health system in the town that you live in isn't taking my insurance. Or you can really think about what is going on and do
mhm,
your education now so that
mhm,
you have a process in place
mhm,
so that you know what to do next. I have been with a provider for years who has not been in a participating network, and
mhm,
so got a
mhm.
kind of a big bill and
Yeah.
said, "Hey, by the way, I'm retired." Don't you love that? I'm retired. I'm on a fixed income, haha.
Uh-huh.
And I know that you have the right to run your business any way you want. But I also have the right to make appropriate changes
Mhm,
in my wallet that
mhm,
makes sense for me.
mhm,
So, because I got the big bill, I decided, yeah, I think it's time that I step away
mhm.
and make that kind of decision. So while that pains me, I just have to be honest with myself and make
Right.
an important decision.
Mhm.
And because he has the right to run his business the way he wants to,
Sure.
and that's what the health system is doing. And I got that
Mhm,
very clearly way back in the way back early in my career for a therapy visit.
mhm,
The provider would have been paid $100 or would have to pay the therapist $100, and but it didn't matter if it was managed care. They were charging $100, but you were only
mhm.
getting 75. Well, how
Yeah.
long do you think that you can do that yourself personally and miss out on $25 a visit?
Yeah.
So this is what's going on in our
Mhm,
world, and you have to respect it. And the other thing that Mary Jane said that is so important is that even though your costs may be going up, and now we're seeing that the costs are being contained in a better way with the drug plans, yippee skippy, but
mhm.
that doesn't mean you're going to get all these freebies anymore in
No.
your Medicare
Right.
Advantage plan. So be
Mhm,
aware of what is going on so that you're not caught off guard when you
mhm,
have relied on those funds or that money that
mhm.
they've been giving you back. Remember, it's all just about numbers.
Right. And the reason that there are so many Medicare Advantage plans in a given area is because they tweak it differently. And again, it gives us more option as the consumer, but
Right.
one may charge, a $15 per therapy visit, and another may charge $35 per therapy visit. So, what does your health look like? Are you going to have, are you going to need a hip replacement? Do you have hip pain? Do you have knee pain? Are you knowing that after you retire, let's say you're turning 65 next year, and when you get on Medicare, you're going to get your knees done. Well, I would then look at plans that are going to, if you're looking at Medicare Advantage, I would look at plans that have a little bit less cost for therapy visits. So it's so individual, and it's, you can make it a double-edged sword, or you can make it work for you, and you can make it work for you. So I think choice is good. I think too many choices can confuse us, but
Yes.
you the best and what your needs are, who you like to go to, and that kind of thing. The other thing that's really great, I think, is that even you have this $2,000 cap for your medications per year, but also if you can be on a payment plan so that you can pay a certain amount of money every month. I think that's fantastic because it gives people, that you're on this expensive medication, just like that example that you gave, that this little
Hmm.
package was $1,000. She gets one little package for 2 months. She's at her 2,000, or for her husband, whatever.
Right.
She's at her 2,000. She can spread that across all 12 months.
Beautiful.
Yeah, and it's nice. And so when you get your annual notice of change, and if you decide that you're going to stay with the insurance that you have, there will be instructions about how to go about that and how to sign up for that if you would like to do it. So, there avail yourself to those kinds of things. These are really eliminating the donut holes a big thing for people. You're not in
Absolutely,
that.
it is.
Yeah. Plus, it's less confusing.
I
It's like,
never
why
did
do you
get it.
call something in an insurance plan a donut hole?
It
I never did
was
get it, but
it was confusing at best, and I'm just happy to hear the changes. But yes, thank you for sharing that, and I love that budget planning because we all
hmm
want to know where our money is going. So that's
hmm
important. Anything else that you think we should be aware of?
No, I think that just be aware that there are going to be changes because of this change in the Part D plans. Okay. So you have to pay extra special attention to those minute details with regard to co-pays, co-insurances. And then, as you talked about, providers like Anthem, make sure that your providers are still in your network. Um, so it's really, you have to pay attention. And I know too, I think, Linda, one thing I want to say is, I still work in the retirement community world and because I love it. And children of aging parents don't really understand all the time because they're living their life and it's busy. They're
Yes.
working, they have children, maybe grandchildren. They're trying to make sure their folks are good. Um, but if you have any older adult that is on Medicare loved one in your family, ask them about their annual notice of change. A lot of times they get mail from Medicare and they put it aside because sometimes it's a human thing to put aside the things we don't understand. So help them with that
I,
because
I love that. Start the conversation.
yes, say, hey, look, hey, let's take a look at this. I've heard there's a whole lot of changes coming and we want to make sure that you're in the right thing. But for people like our age, Linda, our folks were in regular Medicare with the supplement. So we didn't have to worry about it. Those were the days was, oh, Ma's on Medicare. This is great.
Yes,
Uh,
yes,
but
yes.
it's not that the coverage isn't there. You just have to pay attention. So you have an older loved one in your life, ask them about their ANOC,
ANOC, their annual notice of
notice of
change.
change.
And
Yes.
I love the way, and this really happens amongst the women. Well, my insurance pays for this. Now yours should be paying for that. Why doesn't it pay for that? Well, I just don't understand. You just don't have the right insurance. So
hmm
we got to stop those conversations in their
Yes.
tracks because I didn't get that either. And then I
hmm
finally, when I said, well, give me both your cards. And I had one lady's card in one hand and I put one in the other hand. And I said, oh, well, this makes total sense to me. I said, you have Medicare with a supplement and you have a managed care plan.
Right.
And so there are not going to be these overlaps
hmm
in
hmm
coverage. So stop talking
Yeah.
about and comparing, but get in the right plan that works for you and for your health. And
Exactly.
Mary Jane and I were talking offline before we started the podcast, and I said, Mary Jane, do you see anything as far as the 2025 deductibles going
hmm
up or any of those yet? And she said, no, they're not posted. So
hmm
you can always reach out to Mary Jane,
hmm
independentmedicareadvisors.com. Mary
hmm
Jane Harris is her name, and your phone number again was 636 4,
485 2615.
and you get the opportunity to talk to an unbiased professional and
hmm
have a professional consultation at a reasonable cost that can really help you make
hmm
sense of what could be pretty big in your mind, and especially if your loved one is making changes, moving
hmm
or
Yes.
moving into a nursing home or some big life
hmm
changes. It's time to look at that again. And of course, you're going to get the big book, Changes in Medicare for 2025. And my listeners
Uh-huh.
know I'm a little nerdy and I do love that book because if I have a
Uh-huh.
question, I know the answer is going to be in there. And now is the time to start looking at the what is going to be available in your area because it really does matter. Don't
hmm
worry about Betty Lou who lives in
Mm-mm.
Florida and
Mm-mm.
you live in Illinois, there's no comparison. Each
Mm-hmm.
area offers their own product. Mary Jane, you know that I have a heart for caregivers. You've been a
Mm-hmm.
caregiver. I know you're still a caregiver, a support advocate for the
Mm-hmm.
people who live in your retirement community. But what caregiver tip would you offer those that find themselves in a caregiving role?
A caregiver tip, I think, would be to make sure to make time for yourself, however that is. And don't be afraid to ask other people for help.
And that is hard.
Mhm.
You just gave us a hard one, Mary Jane, to ask somebody for help. Hey, what if we do that? I'll put you on the spot and not intentionally or in a bad way, but just what if you say, "Can you help me with this?" And then all of a sudden you start hearing excuses and or no answers or well, gee, I just really couldn't do. I mean, what do? You just
I would,
we don't recommend punching anybody.
no, I would just, I truly would just say, if we want to continue this arrangement, I'm going to have a break every now and then. So can you tell me when it will work for you?
Oh, cooperation and
Yeah.
communication. I think
Yeah.
Mary Jane's done this before.
Yeah.
Take care of yourself. You know, lifestyle is so important as we
Mhm.
age and we talk about healthcare and we talk about our insurance. But if you actually just put on your shoes and went out the door and went for a walk, I'm going to just
Mhm.
tell you that that's probably the best thing you can do for your health this year in
Yep.
2025. And I
Mhm.
want to challenge anybody who's listening to me today that if you have not put on your shoes to go out the door and take a simple walk, without making four excuses before you get to the door, I want you to send me fan mail because I want to hear
Uh-huh.
from you. Uh, if you are not concerned about your health and you are not concerned about your insurance, who
Mhm.
is? I mean,
Mhm.
Mary and Jane and I care deeply, but you're not
Uh-huh.
necessarily in our line of sight. But
Yeah.
anyway, I'm going to challenge
Just
my
start,
listeners to.
Linda, I don't mean to interrupt you,
No,
but I
you're
think
fine.
that people think of, oh, I need to exercise, or don't make it such a big deal.
Oh, for
Go
sure.
go out to your mailbox, come back. Go around the block. Start small. Do what you can do. Don't think you're going to go to the gym 5 days a week. I mean, that was me. I was like, well, I'd like to, but that's not happening. So I started walking around. Just do a little something,
Yes,
and
and
then it builds.
yes, and then please say hello to somebody who you're going to pass. We
Hmm.
need to start saying hello to people again and having
Yes.
honest conversations. And
Hmm.
so those are my challenges because we know social isolation affects your health. So, a couple
Hmm.
challenges for you today, Mary Jane. I can't thank you enough for taking your time to come on and visit with us today and to give us this great news. I'm going to have Mary Jane's contact information in the show notes. And as always, I value the time you spend with me, and I would love for you to send me fan mail. You can do that through my website. And if there's a particular topic you would like to hear about, or some way that you have shared the show with somebody, this podcast, we're here. We're professionals. We've been there, done that, and our goal is to help you get through a difficult, challenging situation the best we can. So again, thank you, Mary Jane, and thank you to my listeners from Aging in Place Strategies and Answers today.